a beautiful sunny day. Nothing could possibly go wrong, right? Well, probably this has happened to most women. Hi there, my name is Ludwig. I'm currently a Coquitlam college student, and today I'm going to talk about one canonic event of every woman, the menstruation, or also known as the period. I don't know about you, but I have been asking myself, hey, why do I lose blood insanely and still being alive, suffering cramps, mood changes, and embarrassing moments every single month? Well, here's a brief explication of what happened inside of our body that produced the menstruation. The duration of the cycle is different depending the person. But to make it more easier to understand, let's gonna consider it as 28 days. First of all, there are two cycles, the uterine and ovarian cycle. In the uterine cycle, the first phase are the menses, what we know as period. If there's no pregnancy, the progesterone and the estrogen goes down, breaking down the uterine. That is what makes us bleed and feel cramps. Then, in the proliferative phase, the estrogen and progesterone increase, making bigger and thicken the uterine lining again, in case for a possible embryo. And finally, the lining only keeps becoming thicker and thicker in the secretory phase until the next cycle starts. Moving to the ovarian cycle, first we have the follicular phase. To make it simpler, imagine the hypothalamus, which is a part of the brain, making the gonadotropin releasing hormone, who tells to the pituitary gland, also in the brain, to produce the hormones LH and FSH. Then these hormones go to the ovaries and tell them to start making new follicles, which contains eggs. Then the ovaries produce progesterone and estrogen that tell to the uterus to rebuilding in case for a baby. I know many information to process, but if you need more information, you can go and watch the videos in the description. Anyways, later on in the ovulation, the LH increased dramatically, leading to a follicle letting go an egg to the fallopian tube, where fertilization could occur. The next days, during the luteal phase, the follicle become into a corpus luteum that produce progesterone in case for a baby. And if this doesn't happen again, both cycles are repeated.
But why do women have to menstruate? Would they be happier to just don't have it?
Well, my friend, that's why schools should provide more information about menstrual health. Probably the main reason for teenagers to have a constant period is just to make sure that they are not pregnant. But actually, the menstruation also is a factor that doctors find helpful for medical diagnosis. It also helps you to know if your body and organs are working well or if you have any disease or disorders.
But what kind of disease or disorders?
That's a good question, and thanks for asking. Many women probably have experienced or heard about painful cramps or headaches, but it's rarely spoken of amenorrhea, which is the absence of the period for more than 3 months. And here is when you should get worried. Some of the main causes are functional hypothalamic amenorrhea, that is when period stops because the hypothalamus doesn't produce GnRH. As consequence, any follow process can work. The causes can be eating disorders, weight loss, low body fat, excessive exercise, and psychological stress. Another cause is primary ovarian insufficiency that occurs when the ovaries stop producing estrogen. Some causes are genetical, autoimmune conditions, infections, and radiations to the pelvis. Other causes of amenorrhea might be thyroid disorders, hyperprolactinemia, polycystic ovary syndrome, that actually they're not an exact cause, and other diseases as obesity or diabetes. Now, it's important to treat any of these causes because if it's not, some consequences might be metabolic syndromes, rheumatoid arthritis, iron deficiency that leads to anemia, infertility, osteoporosis, cardiovascular diseases, and endometrial hyperplasia, which also increase the risk of endometrial cancer. That's why, before or after losing the period for any reason, it's important to take care of your menstrual health by incorporating to your life some healthy habits, such as eat intuitively and enough protein, prefer to do intense activities in the follicular phase and low intensity in the luteal phase, prioritize sleeping, drinking water, being active, avoiding substance, minimizing stress through relaxing exercise, keep a good hygiene during your periods, and go to the gynecologist or other specialists regularly. Maybe because this is a video about a girl's topic, guys may or may not have liked it. But also, it's important for everyone to know about this topic and be more emphatic with women, please. That's all for today's video. I hope you learned something new. And if you have any doubt about this topic, you can go and check the links below. I may finish my task, but my body and cramps are still on attack. Ciao!